How to know if you are a good candidate for a home birth after cesarean. Hi everyone, I'm Sarah. I'm one of the co-primary midwives of Hearth and Home Midwifery in Portland, Oregon, and this is Midwife Monday, weekly Q&A where we answer follower questions. So if you're new to our page, please follow along and you can ask questions every single week from us, the midwives. If you want to know if you actually are a good candidate for an HBAC, the people to talk to are actually midwives, because we are the ones who attend the HBACs. We work regularly with people in the community setting. We know what medications we carry. We know what our training is. We know how we do risk assessment. We know how to support physiologic birth. A hospital-based provider is never going to recommend an HBAC, and they definitely have never been to an HBAC. So they're just not the best people to really be advising on what is actually going to work and be appropriate with informed choice always at a home birth after cesarean. And when we say informed choice, what we mean by that is that you are an autonomous decision maker in your obstetric care. Our job is to provide you evidence as well as we can, as well as our clinical experience, and it's your job to make decisions. So for some people, they're gonna want an HBAC, and if they want an HBAC, it just makes the most sense to talk to providers who actually do HBACs. So good candidates for HBAC are typically people who had a cesarean for a reason that we can reasonably think isn't going to happen again. So you were coerced into an induction, baby had fetal distress, or you didn't make progress and you had a cesarean. Maybe you had a cesarean for a perceived big baby or a breech position, something that we could help you to deal with in the future. A planned cesarean and you never even got the chance to labor. Cesarean for twins and you're not pregnant with twins this time. Just worked with an obstetrician who just didn't really value vaginal birth and didn't wait very long. So there are so many reasons why people have cesareans. The cesarean rate in the United States is way above the World Health Organization's recommendation, which is about 10 to 12% of all births will need to be a cesarean for the safety of the mom or the baby. In the United States, we hover at about 30 to 40% of births are cesarean, and that's way higher in certain communities. And so there's a huge gap between who's having cesareans and who needs to be having cesareans. And in between there's a lot of opportunity for VBAC and HBAC. But the truth is most people probably can have an HBAC who want one. I would advise you to meet with a specific midwife and talk to that practice about your case, what happened with your birth, and whether those things can reasonably be eliminated to help support you to have a vaginal birth.